Hello, I'm Lucille. I'm a PhD student in the AI4Health Center for Doctoral Training at Imperial College. And today I'll share a little bit about my PhD project. I'm in second year of my PhD, and I've been working on trying to integrate new AI technologies into helping people after stroke, so who have lost their mobility in their arm, to try to regain independence bit by bit. So how we're doing that, I'm using robotics and electrical stimulation. So we're putting electrodes on the muscles and sending short electrical current and generating motion through that. And with that, I'm combining with reinforcement learning to develop an intelligent agent that can develop personalized assistance to the user and help them regain their motion. And so just recently, I've moved my system to a clinic in Germany. And it's actually really exciting to see that, okay, actually the things that I'm developing in the lab is going with patients. It's working, the therapists really like it. And I hope that it will be changing people's lives. So what really attracted me in applying for the AI4Health Center for Doctoral Training, and also what's really making me so happy to be part of this, is that it's really a great environment to be in, because you're surrounded by students who are so interested in similar topics as you are. So really AI for good, so really applying it to the medical field and trying to really make an impact, a positive impact into people's health. And so that's really a huge benefit, because sometimes it's hard when you're doing a PhD and you feel like you're stuck in your project, but actually because you're part of this bigger group, you can discuss ideas, you can exchange things, and you really can take a step back from your PhD and see the broader perspective around it. I think another aspect that I really liked is the format of the CDT, because in the first year, we really had the time to focus on learning new topics, on developing our knowledge in AI, machine learning, deep learning, and then take the time to do that to then further apply it within our project. The team behind the CDT is also so great. They're always here for us, for personal issues, professional issues with anything that we can have. They're just always listening. So I think that's also really important, something really important for me. And yeah, it's just so much fun to be surrounded with this great bunch of people. So people that started the PhD at the same time as you, but also people from the cohorts above and below, just chatting around. And the CDT is organizing quite a few events. So we have like Christmas dinners and then the summer party, and just during the year as well, because we're usually sitting in the first year in the same sort of office area, it's also really nice to just be there and have lunch and coffees together. So one of the great opportunities in being part of the AI4Health Center for Doctoral Training was to be able to take part and to join the courses from the AI Masters of the Computer Science Department at Imperial College. And we joined a lot of courses, but one of my favorite, I have to say, is the one on ethics and fairness and bias in AI. And so that was really cool because it was sort of divided in two parts. So there was one part on like ethical considerations and sort of philosophical questions on developing an intelligent agent that is autonomous and not a human anymore. And the second part was more on learning the technical methods that we can use and tackle to sort of remove bias and increase the fairness in the machine learning models. And I think also because I'm a woman working in research and in robotics and computer science, I think that was really cool to see that you can really make a change in the data. Although historically it was some population were underrepresented, we can now change, do something in the right direction to bring a positive impact and bring more fairness into what these models can do. And I think that was really my favorite course. So the CDT conference with all the other like AI4Health CDT was really cool because we really got to meet with students from other cities in the UK kind of studying similar topics. I think it started last year. It was the first year that they did this. And we were in a city in the UK, and all the PhD students from these CDTs were gathered. And so it was such a great opportunity because so obviously we had great talks from like speakers from the UK in the topics of machine learning and deep learning, but also we were able to present our own work with posters and presentations. So it was like super nice to be able to talk to other people as well, to interact with other students that are doing sort of these similar projects, and also that, you know, we had this formal kind of interaction, but also later we had like dinner and the cocktails, and so we could really share like about more like the personal things of what it entails to be with a PhD, and you know, all the things. So that was really nice, and actually they're also redoing it this year in New York, so I'm quite looking forward to it. So the CDT also organizes like special events and special training that I haven't really seen in other places before, and one that I really enjoyed was this kind of Dragons Den training. So it's where we had to present a sort of startup idea in front of the dragons. So there were like a group of people from industry, startup owners, people from the policymakers, people from the NHS, also academics. So I think that was a really good crowd, and so we had to present like a concept idea, and I in my group presented a project that was quite close to my PhD. So it's really interesting, and so we presented the project and we worked in group to really like put the best out there, and the dragons really came at us like very seriously, took their job of dragons, and asked us so many questions. And I think it was really cool to be like pushed, you know, to be the best and to answer all these questions that some of them I hadn't really considered, because they're so way like down to earth on like how you can apply this to society, how can people reimburse this kind of technical things and this new research in the medical field. And so I think it was such a great learning experience, and it really put perspective into how our PhD project can have a positive impact in society. Also because I think in the CDT we're so lucky that everyone is doing such different projects that we're really covering a wide range of things, and if some are successful, I think it could really make a change in how we approach medicine and technology together. I think that's really a great learning environment to be in.